Hey everyone, it's Dr. Baird at Evolve Performance Healthcare. Today we're talking about the best things you can do to treat IT band syndrome so that you can continue to walk, run, hike without knee pain. So, quick introduction, the IT band, all it is a thick piece of fibrous tissue that runs down the side of your leg. From here all the way, usually inserts down at the knee. People that suffer with IT band syndrome generally feel the pain on the outside of the knee. It's like a tension or a pull. Sometimes there's a click on the outside of the knee. Usually when they're doing those repetitive motion sports, walking, running, hiking is usually when you feel it most. This is a topic I have a lot of familiarity with. I actually wrote my master's thesis on the best ways to treat IT band syndrome. Read through a lot of studies. Yeah, there are a lot of studies regarding the best ways to treat IT band syndrome, which I kind of sum up here. So getting right into it, the very first one is strengthening your glute med. If you do one thing for your IT band, you need to strengthen your glute med. That is the muscle on the side of your hip. So again, you've got your glute max, your big muscle back here, your glute med is on the side here. What happens if we have weak glute meds is when we're running, it causes our knee to cave in or our hips to duck down, like my shoulders, kind of like that. And what happens if you do that, if you're a walker or runner, the more miles you put on it, the more strain you get on that IT band, it eventually leads to pain that limits you from doing all that fun stuff that you like to do. So that's the very first thing you want to do, strengthen your glute meds. The other is you want to lengthen the things that kind of attach and contribute to that IT band syndrome. So the three muscle groups really to focus on, one is your TFL. So that's the muscle small muscle right here in the front of the hip, and your glute max. So if you're tight in your glutes or your TFL, those two muscles kind of converge to form that IT band, and that's where you want to spend your time lengthening. I'll just repeat that you do not need to lengthen or foam roll or do anything directly over the IT band. One, it's very painful, and two, it is firmly attached to that femur or your leg bone. So it's not going to lengthen to ease any tissue. Your best chance at lengthening anything to provide a little ease of that tension down at the knee is to focus on that TFL muscle and that glute max muscle. The very last thing that you would want to focus on is single leg balance. So again, runners especially spend about 60% of their time in the single leg stance. If their bodies aren't strong enough to support that position, what happens is, again, here's my running position. If I'm not strong enough to hold this position, one, my knee can kind of cave inward like that, which again, repetitive stress on the outside of the hip. And then the other one is that my hip can kind of drop down there. Same thing we talked about with the glute med. If we're not strong enough to hold this position, again, just strain all down that lateral chain. So those really are the best things you can do to treat IT band. It's going to be strengthen your single leg stance, strengthen your glute meds, and then if you're going to foam roll or stretch, make sure it's that TFL glute med. Doesn't need to be the IT band in particular. If you click the link down below, I do have an article that has some great exercises to strengthen those areas if you need some more information. But that's all I got for you. So if you're suffering with IT band syndrome and you need a little bit of help, check out the article down below. Thanks for watching. Bye.